An oximeter, also known as a pulseoximeter, is a medical device used to measure the oxygen saturation level in a person's blood. It's a non-invasive and simple tool that provides valuable information about the amount of oxygen being carried by the red blood cells. Oxygen saturation, often abbreviated as SpO2, is a critical parameter, especially for individuals with respiratory or cardiovascular conditions, as well as for monitoring during certain medical procedures. The main purposes of an oximeter include 1. Oxygen saturation monitoring. The primary purpose of an oximeter is to measure the oxygen saturation level in the bloodstream, often abbreviated as SpO2. This measurement indicates the percentage of hemoglobin, the protein in red blood cells that carries oxygen, that is saturated with oxygen. It provides crucial information about how well oxygen is being delivered to different parts of the body. 2. Respiratory and cardiovascular conditions. Oximeters are particularly valuable for individuals with respiratory or cardiovascular conditions, such as chronic obstructive pulmonary disease, COPD, asthma, pneumonia, heart failure, and other conditions that affect oxygen levels in the blood. Monitoring oxygen saturation can help assess the severity of these conditions and the effectiveness of treatment. 3. Post-surgical monitoring. After certain surgeries, especially those involving anesthesia or where there's a risk of breathing difficulties, oximeters are used to monitor a patient's oxygen levels during the recovery period. This ensures that the patient is getting sufficient oxygen as they regain consciousness and resume normal breathing. 4. Physical activity and altitude. Athletes and individuals engaging in strenuous physical activities, as well as people at high altitudes, may use oximeters to monitor their oxygen levels. This can help prevent altitude sickness and assess the impact of physical exertion on oxygen saturation. 5. COVID-19 monitoring. During the COVID-19 pandemic, oximeters gained additional importance as a tool for monitoring oxygen levels at home for individuals with mild or moderate symptoms of the virus. Low oxygen levels can be an early indicator of respiratory distress, prompting individuals to seek medical attention if needed. 6. Sleep apnea. Some individuals with sleep apnea, a sleep disorder that affects breathing during sleep, use oximeters to monitor their oxygen levels and assess the effectiveness of treatments like continuous positive airway pressure, CPAP. It's important to note that while oximeters are valuable tools, they should not be used as standalone diagnostic devices. If you have concerns about your health or oxygen levels, it's essential to consult with a medical professional who can interpret the results and provide appropriate guidance.